Welcome back, Menopause Energized, featuring the 30-day Healthy Heart Marathon. We're in today, number 13. Welcome back. This is Sheila, registered nurse and health coach with the program Menopause Energized. Today, in the next few days, we're going to talk about how important movement and exercise is in your menopausal years. It's too much information to cram into one session, so we're going to divide this up into about three sessions. Yesterday, I built the foundation. I wanted to talk about how important and how vital the oxygen flow to your heart and lungs are, and we talked a little bit about that yesterday. So today we're going to continue with menopause. Movement equals a healthy heart. It is so important again because cardiovascular disease is the number one heart risk in women in their menopausal years. And again, we're going to review it real quickly because we went over all this before in one of the previous sessions. When the estrogen level declines, it leads increased risk to heart disease. And so we have increase for high blood pressure. We have an increase of type 2 diabetes because the fat around the belly increases that risk. Weight gain, again, menobelly we call it. The weight shifts to the belly area. And then high cholesterol and triglycerides. Estrogen controls that. And so when estrogen starts declining, estrogen can't help out as much. So you may find yourself having a higher cholesterol level and higher triglycerides level. Now the benefits of exercise, again, it improves heart function and circulation like we talked about yesterday. Yesterday we basically talked about how the oxygen helps the heart and lungs, and breathing exercises we should even be doing during the day, even if we're not physically exercising. Because what some of us don't realize, we may not be taking the right type of oxygen in because we may have some shallow breathing at times. And that can happen. That definitely can happen. And so the benefits of exercise, it improves, like I said, the heart function and circulation. It also lowers the bad cholesterol. So yes, when you keep your circulation going with exercise, it lowers the bad cholesterol and it raises the good cholesterol. The bad cholesterol, like we talked in previous sessions, is the LDL. The good cholesterol is the HDL. And then also it increases insulin sensitivity, reducing diabetes risk. So the insulin from your pancreas works a little better the more exercise we get in. It also supports the weight management and visceral fat. We talked about visceral fat earlier and what visceral fat is and the difference between visceral fat and subcutaneous fat. Again, usually subcutaneous fat you can see, you can pinch. Visceral fat is the visceral fat that's surrounding your internal organs, which can be dangerous. And then, believe it or not, big one. Trust me, take it from me. It boosts mood and helps reduce stress. If you ever have like these moody days or you're stressed out for the week or even a month, try, if you're not exercising or if you are, pick up on your exercise, try to make it a regular routine, and it makes along with nutrition, of course, it makes a huge difference. The American Heart Association said you should get 150 minutes of exercise in a week. And we'll talk about tomorrow what type of exercises you should be getting in the 5 days. But then there's also a little surprise for the last 2 days as well. We'll talk about that tomorrow because sometimes it's not just about how much exercise you do in minutes, but what type of exercising are you doing during the week? Because if you're doing the same exercise day after day after day, then you will wear your muscles out. You need to rotate different types of exercises. So 30 minutes a day times 5 days is the American Heart Association. And I just said rotate with different types of exercise. Warning, warning, warning. You should always consult with your doctor about what type of exercise regimen you should be on, especially for anyone on this video that has any type of heart conditions. Please don't go and do any type of strenuous exercise and overdo it if you have a heart condition. You should always check with your doctor what your routine should be physical routine should be as far as exercise if you have a heart condition. If you feel like you don't have any heart issues, it's still a good idea to check with your physician or what type of daily routine exercise you should be on. So when I go through these exercises in the next 2 days, it's just a baseline. It's not going to be anything really strenuous because, like I said, you should always check with your doctor. But I will start at the baseline of what these exercises should look like. But again, this is how people get themselves in trouble and wind up having chest pain, angina, and shortness of breath. And then maybe some of you all have never been to the doctor or don't go that often, and you do have an underlying condition that you were not aware of because you have not been to the doctor to get your yearly physicals. And then when you're exercising or you're doing strenuous exercise, all of a sudden you experience chest pain. So you should always check with your doctor about what type of physical exercise routine you should be on, and if there's any restrictions as far as following the American Heart Association recommendation. So basically that's all I wanted to talk to you about today was getting started, letting you know what happens when the estrogen declines and why we need to keep moving on to go. Tomorrow I will get into the different type of exercises and talk to you about that. And then at the end, or the last session, because today is part 2, and it should be, I think, part 4, I believe we'll be going to 2, 3, 4. I will have down in the link when it ends a PDF that gives you that 5-day routine of exercises. Of course, you modify the way you want, but I will have that ready for you as well at the end of these sessions. So until tomorrow, take care. And again, take care of your heart.